राधा।
अस्सलाम वालेकुम।
वाह,
आवाज है क्लियर?
हाँ क्लियर है।
कुछ लोगों का क्वेश्चन था, वो लोग कहे हैं कि आपके साथ डिस्कस करने या आपको बोले कि कुछ पॉइंट पे थोड़ा शेयरिंग कर देने के लिए। और जैसे कि एक मेरा है एक क्वेश्चन कि हम लोग का एक सीरीज वेबिनार की एक सीरीज चल रही है फीमेल कॉन्स्टिट्यूशन के ऊपर, जिसका हम लोग अब पार्ट 5 जून में शुरू होने वाली है। तो एक फीमेल कॉन्स्टिट्यूशन एक पार्ट होता है, या फिर फीमेल डिजीज या फीमेल डिसऑर्डर या फीमेल कंप्लेन। हम ट्रीटमेंट एक फीमेल का जो करते हैं उसके कॉन्स्टिट्यूशन पे करेंगे, या उसकी जो बीमारियां हो रही है जैसे कि पीसीओडी हो गया, सिस्ट हो गया, और फिर जितना भी इनफर्टिलिटी वाली कंप्लेन आ गई, जिस तरह से चॉकलेट सिस्ट, तो ये सब के हम लोग पर्टिकुलर डिजीज पे उसका ट्रीटमेंट करेंगे, या फीमेल की अगर अलग कॉन्स्टिट्यूशन होती है।
From homeopathic prescribing point of view, we have to consider the patient's personality. Rarely we consider the disease diagnosis, rarely. As I take it in my personal view, that if we are going to learn the personality of a woman, as we are doing in our few classes, it is going to cover the known disease as well as unknown disease of a female, as well as diseases going to develop in future. There's three factors. If you have got PCOD, if you are considered patient as a whole, personality of a woman by Bovista. I'm just saying, what I'm going to taking from Monday, the personality of a woman, phosphorus personality. Before I have taken Suriname personality. So if I am going to taking or considering patient for PCOD, so maybe uterus is going to evolve in future, or maybe some diseases is going to persist unknown to the physician as well as unknown to the patient. If you prescribe a remedy for the whole personality of a woman, it will consider all three areas, three dimensions of prescribing. In my humble opinion, in my experience with my teachers and my own clinical bedside, I came to a conclusion that it is better not to go through the therapeutics. Dysmenorrhea, menorrhagia, rather being learn the meteorologic personality, dysmenoric personality, PCOD personality. It will help you to consider on the philosophy of homeopathic holism, or we can say isomorphism. That's why I always prefer to discuss my view on the basis of holistic approach of homeopathy. I have a future plan that I am going to discuss about children's, the most important uh, personality over which our whole generation is going to be dependent. So if you correct personality of a child since the intrauterine life, we are going to making a strong family uh, power, family immunity, by which I can say that even if I am going to consider during the intrauterine life of a baby, future generation is going to be safe with the malignant and immune diseases. Autoimmune disease is one of the another very important factor in your daily life, present situation, autism, etc., etc. So if I am going to consider during the time of intrauterine life, I'll find one thing: the whole generation is going to be benefited by this immune boosting from homeopathic system of medicine. That's why next my program, I have got a further program to discuss about the geriatrics. Another very confused, people are using different way to treat geriatrics. But my friend, one thing you remember, that geriatrics means you consider patient as a whole in the old age. Old age is a required treatment to just make a comfort to the patient. Don't try to make cure in the old age cases. If you are going to give medicine hypertension, as well as you consider some of the medicine which is not suitable, if you prescribe, that may harm to the old people. So prescribing old people, I think it requires skill, especially with the homeopathic philosophy, and I can say that art of prescribing. This is my view. That's why I am choosing a little bit therapeutic, but personality therapeutics, holistic therapeutics. आप और कोई क्वेश्चन?
गुड इवनिंग सर। सर का
अच्छा, उपाध्याय साहब आ गए हैं।
गुड इवनिंग सर, गुड इवनिंग।
नमस्कार सर।
नमस्कार।
उपाध्याय सर का 2 क्वेश्चन है। एक क्वेश्चन है सर का कि बेलाडोना का जो सिम्टम है ट्रांसफर कॉलन प्रोट्रूड लाइक अ पैड, तो उसका एक्सप्लेनेशन वो उसको एक्सप्लेन करने कहे सर।
ये डॉक्टर उपाध्याय साहब का इससे पहले भी एक बड़ा स्ट्रॉन्ग क्वेश्चन था, and that is very important question and little known to the whole professions. It is physical irritability, which is given in the Helensky note, one of the strongest characteristic feature of nitric acid. I am thankful to Dr. Upadhyay who chose to the point, especially by which a profession is going to become matured. Profession is going to become know the art of prescribing, understanding homeopathic materia medica. Our problem, that materia medica, we have got lots of symptomatology, and especially Helensky note and Boger synaptic, which we are not going to be able to understand nor we use in our daily practice life. For Upadhyay ji, I am just going to make one more indications in favor of nitric acid physical irritability, which I have found recently in one my case, that some of the high speed fan, that high speed fan is going to irritate the patient. The ear is going to making a slight touch to the fascia on the body, which making irritations.
Okay.
And I found a strong characteristic feature of nitric acid, desire and demand for a thick layer of butter. By only considering these 2 important symptoms, I prescribe nitric acid.
Okay.
This is physical irritability. And
Oh,
gradually, as our experience and the cases of failure cases, these all are failure cases by which I learned the physical irritability. Now,
okay.
another question, very important question of pad-like protruding in the transverse colon. Unfortunately, the question is given to me by Arkham just recently. Otherwise, I make to it one photograph, especially related to the abdomen and abdomen with the transverse colon.
Yeah.
When you go through the transverse colons, just watch what are other important organ is going to touch or behind or front.
Okay.
It is my anatomical understanding of prescribing homeopathic materia medica,
Oh,
especially on the basis of anatomical understanding of indications.
oh,
I have got 4 or 5 cases of
oh,
pad-like.
oh,
Two, I think I remember 2 cases in Delhi
oh,
and maybe 2, 3 cases in Calcutta. One
oh,
case I like to share with you, which is very helpful for you just to understand. And later on, I keeping in mind, I'm going to discuss as I discuss uh, physical irritability with my new experience. I'm
oh,
going to discuss more deeply about this pad-like symptom.
okay, sir.
In fact, this symptom is given in a more simple letter, not bold, not italic.
Oh,
First, I like to confirm it, either italic or bold.
okay.
Even common letter, Roman letter is not less than.
Oh,
Question of characteristic is not less. Question of intensity is slightly lower. There
okay.
is a two. One question of characteristic and keynote. Another is intensity of the symptom. So a symptom which is very characteristic, strong characteristic of a remedy is persisting,
Oh,
irritating,
oh,
annoying, blinking.
oh,
And today I discuss about one factor of concomitant symptom is a barking dog.
yeah.
Means something wrong. Concomitant symptom is also a barking dog.
Oh,
Something wrong. We must take care.
oh,
Therefore, the symptom of protruding pad is mostly nearby the gallbladder. I found, that in practice of medicine, one important factor is referred symptom.
oh,
So referred symptom is also to be considered as in a case of appendicitis, referred case, and
oh,
referred symptom in a case of gallbladder also.
oh,
I remember one of my case which is very helpful to you to make in clarity about the importance of pad-like protruding symptom.
oh,
The patient was a young lady,
oh,
very active and very active by appearance as well as by nature. I know personally, suddenly I get information from mobile that she has got severe pain in the gallbladder. Maybe a stone, maybe cholecystitis. But the question is to relieve the pain. Now, it's near about midnight. I asked only one question. What the patient said. Always remember, my friend, for making acute cases, to allow the patient as much as possible to speak from their own feeling, not by family members. I asked, but she was so much painful conditions that she is not able to answer. Only say thing, मेरा पेट फूल गया. And that's what's this? And the मेरा पेट फूल गया. मेरा पेट फूल गया है. But the pain was, it is my conclusion that the pain due to the gallbladder, later on it was confirmed. And the patient has got a feeling of this belladonna. Appearance of the patient is very reddish, appearance very active facial expression, which we will find in a case of temperament of the belladonna, sanguine temperament. Restless, that too much. And patient is gradually developing the fever. Means inflammatory condition is going to develop more. I ask only one thing. Do you have got any urine? People told me, yes, just few minutes ago, she passed urine. And the urine is normal or very hot or cold? They reply me, hot urine. And फूला हुआ पेट का ऊपर फूला हुआ पेट का ऊपर फूला हुआ है. I consider it is a pad-like protruding sensation.
Okay.
And I consider belladonna 1 mm. I say you, my friend, especially in a case of gallbladder colic or kidney, if you feel this pad-like sensation or swollen sensation, especially in the transverse colon, patient to anatomy नहीं जानता है. Patient only knows ये मेरा तकलीफ, ये मेरा जलन ऐसे हो रहा, ऐसे हो रहा, ऐसे हो रहा, ऐसे हो रहा. Our knowledge of anatomy is going to be considered, approximately considered, not exactly. And I think from homeopathic point of view, that especially localized area is we always consider approximately, not exactly. So, for which anyone ask me about any reference, to please study T.F. Allen handbook. When T.F. Allen is going to introduce his way of the proving and collection of the symptom. Because at that time was not very much advanced. Ultrasonography, that not much. We have to consider, it's still the most advanced stage, to consider patients, approximate everything, as I am doing in my life. Maybe someone who is more expert than me is going to consider exactly. But my humble opinion, according to the homeopathic philosophy and law of similia consider similar, not same. All these helped me a lot to understand about the concept of the localization. I have few more cases where the patients mostly say in our front of sitting during the consultation, I have got pain, consider as if something is going to become puffed. And he described or she described about area. This is very important for homeopathic physician. That when the patient is going to describe by their own hand, I have got pain here. I have got toothache. To give me a relief like that. I have got pain in the umbilical region. This denoting or expressing by, that's I call intensity of the symptom. And as I just few minutes ago, I say about importance of the intensity. Characteristic is a different thing. Intensity is a different thing. When characteristic and intensity meet together, the question of keynote prescribing. Characteristic is going to be a keynote when it's going to be covered with the intensity.
Okay.
Severity. The severity we are going to learn by the patient expression, body language, and the feelings.
Yeah.
I remember on phone a case of a lady, young lady, about 17 or 18 years old, from Saharanpur, UP. A call that a severe feeling of pain in the lower abdomen. I said, whenever you have got information that lower abdomen, you must first ask, if a woman, first ask about the patient has got menses or not. Her mother told me, yes, she got menses, because especially in our Indian culture, regarding question of menstruation, mother and the patient not going to disclose as easily as we need. So in this case, she told me about that severe pain, patient is severe cry. I simply asked one question, that do you have got patient, the flow of the blood is cold, hot or normal? Her mother told that flow ऐसा लगता है कि गरम गरम पानी गिर रहा है. That is one strong symptom in favor of the blood. I remember that patient's lady is very sanguine temperament. So you know that in early stage of the cases, early pathology, the time of Hahnemann and the post-Hahnemannian stalwarts, this temperament are coverage of the most important, both mental and physical. That is, I am saying sanguine. That is, I am saying psychosomatic. So lethargic or leukophlegmatic, this is written in our homeopathic Materia Medica. But unfortunate part, the way teachers are not going to explain seriously, to make an impression on the student's mind. See, this is sanguine. See, it is bilious. See, this is so and so. If you are give a teaching of our students, exact expression of this melancholic. I will give you one example of melancholic. The patient, mostly melancholic patient, his face is going to become very much dull, dry, and not any life. And my experience for this melancholic personality is mostly going to become one side. This is a typical expression of melancholy. And I found in this involuntary sighing, I consider Ignatia Amara.
Yeah.
In the OPD of National Institute of Homeopathy, I have got only watching my patients by body language, the language which is very important for the consideration of the characteristic symptom, as well as some important indication as melancholic temperament, as sanguine temperament, all these. So prescribing, considering one of the important characteristic as a temperament, I think we are losing present day prescribing. I hope the young generation is going to consider this holistic, I can say the holistic psychosomatic pathology. Dynamic psychosomatic pathology. I think, Upadhyay ji, I consider your question of the fat-like reading censorship with few examples, more examples related with this type of the symptom. Now your next question. Akam,
हाँ, सर का ही क्वेश्चन है एलएम पोटेंसी के यूजेस के बारे कि किस तरह हम लोग यूज करते हैं और क्या उसका।
देखिए उपाध्याय साहब, आज के जमाने में एलएम पोटेंसी एक फैशन हो गया है, ट्रीटमेंट नहीं। हम एलएम पोटेंसी यूज करते हैं तो आई एम समथिंग सुपीरियर टू अदर होम्योपैथिक डॉक्टर. दिस इज द फीलिंग्स of present day generations.
Great.
And I have many books of the LM potency, which is nothing but the copy paste. And this is not very helpful. The basic हम एक दो बात आपसे करेंगे बस. फिर कभी मेरा मौका अगर मिला मुझको बहुत अच्छा सेमिनार करने का, बड़ा सेमिनार करने का एलएम पोटेंसी पे मेरा प्लानिंग है. लेकिन आपके लिए as you are very practical physician, and your question itself shows me two things. You like me, still learner.
Mm.
I'm still a student. Your question asking me is make your personality very high and the seeker of the knowledge, thirsty for the knowledge. Acquiring knowledge, your one point target, which give me a too much very good impression for you and your attitude. I hope in future you are going to be one of the best prescriber in India and abroad also. Because a man has got tendency to learning as like me. Still I am everywhere searching of a knowledge.
Yes.
Because I am imperfect as well as not knowledge for especially homeopathic prescribing.
Yeah.
By searching and constant searching, we may get one day some information which helped me a lot to cure a case. In my early life, college life, NIH life, I am jumping from one teacher to another teacher. I'm mad for prescribing, learning prescribing. Sometimes people not allow me to sit. At least he allow me to stand. I'm very happy. By this way, I'm learned some of the art of the homeopathic prescribing. About LM potency, one basic things which I like to share, that is two factors. Why Hahnemann choose LM potency? Why he considered? One, why he considered and what age he considered? What circumstances to make him to consider a new potency, new scale of potency, I am saying. At that time, Hahnemann was about in the old and matured phase of his life. And he was too much anxious and anxiety, having the patient's aggravations. He was always searching a tool, practical tool, by which is going to reduce, at least reduced, not overcome, at least reduce the homeopathic aggravations. And the question, according to Hahnemann, the first phase of the aggravation is when the requirement of homeopathic cure. What factor is a requirement of a cure? Aggravation, as well as a difficult part of the patient. As Hahnemann was a very matured humanitarian human physician. And that's why he was always rush for consideration of the making free from pain, discomfort, either after prescribing or the giving treatment. You know, why homeopathic medicine is going to be superior than any system of medicine? By one,
Mm.
is not going to produce any side effect,
Thank you.
is not going to produce any type of discomfort, is not going to produce any disease we call iatrogenic diseases. This is the unique beauty contribution for the whole system of medicine by Hahnemann. Every system of medicine has got their side effect.
Mm.
Homeopathy is the effort of Hahnemann's noble soul, which I thrice blessed, who is going to be controlled. The no side effect of the medicine of homeopathy. This is one single contribution of Hahnemann, is making Hahnemann the Hahnemann and the whole. So this is LM potency is one of the way of reducing two factors. One, there's no side effect.
Mm.
Another, this old age Hahnemann going to facing cases of mostly old people
Mm.
and advanced pathology. Those who have got very sincere student, I'm saying student means not BHMS, I'm saying student, those who are learner. No age is the bar, no
Yeah.
age is the factor. So in this situation, please go through some of the writings of in favor of Hahnemann or against Hahnemann in the later part of the Hahnemann's life about his cases. Two factor one we will, especially I notice, sometime he frequently changed the medicine, which was not the habit of Hahnemann before the Paris practice. Means then watch the cases, worse cases, pathology advance, old age advance, all things is required, as I experienced in my later life of my cases. Patients of old age is frequently changing their medicine, symptoms, sorry.
Yeah.
And their old background of some of the suppressed indications are going to gradually develop and to face to the patient,
Yes.
which is noticed by a good homeopathic physician. All this helped me learn homeopathic and Hahnemann attitude in the later part of his life, that the patients need frequent stimulations,
Yes.
not single stimulation and sleep. No. It is also helpful, as if it is not helpful, then Hahnemann condemn it. As his nature, whenever he has got any fault, he criticizes himself. When it is found the beneficial effect of the sentimental potency, that's why he not reject in any places.
Indeed.
He use LM potency, but not reject sentimental. And his later life practice consists of both, especially 1840, 38, 39. All these are the era where Hahnemann, especially 1833, after the publication of the 6th edition.
Tradition. Yeah.
My simple saying with you, that Hahnemann's always searching of panacea, means the medicine.
Give it.
In homeopathic practice, the medicine is not enough. The potency, the medicine, the potency, the dose, the deputations. So in my experience, I am using LM potency, especially either in old age people where I need repetitions. Grown up children where immune is not going to be very strong, need repetitions.
Okay.
And some of the advanced pathology like autoimmune diseases as well as cancers, etc., etc. Where I'm just going to one part, touching one part of the importance of LM potency. Now, where there is a more different factor which I am using LM potency in olfaction. I am using LM potency is small quantity, small dose. I am using LM potency in the large doses, which Hahnemann said in aphorism, especially 6th edition of the Organon, when the disease in the miasm is on the superficial layer.
Yeah.
Sora on superficial, psychosis on superficial, syphilis on superficial. Where Hahnemann used is strictly given direction in the 6th edition that you use not centesimal, you use here the 50 millisiemens potency, frequent doses as well as large doses, not small doses. Hahnemann himself cry and strongly suggest one single dose and wait, which he changed in the 6th edition. Hahnemann always consists small quantity, small doses, but especially in primary stage of the solar syphilis psychosis, he considered no, you give large doses, frequent interval, large doses. He changed both scale from centesimal to the 50 mils. From single dose to
Multiple doses.
multiple doses.
Multiple doses.
From small doses to large doses.
Last.
This is the wisdom of Hahnemann, as well as I can say that it is a wisdom of Hahnemann. I can say that it is a man who is very true. I trade the truth flag to consideration of the human suffering. And that's why I am using also similar way, similar fashion. I am not going to be making any extra something. First I follow him, then some during my experience, if I have got anything new, which I like to share with my professions. But importance of following him is a first and primary judgment as a homeopathic physician. And I judge myself. I am thankful to the noble soul of Dr. Kanjilal Sahab.
Yeah.
At that time, I was assisting him. One day he told me, but my Guru, Dr. Gyan Majumdar Sahab, was never used in life of the 50 millisiemens potency. I learned it fully from Dr. J.N. Kanjilal about the doses, about the dose and the dips, single globules, etc. I all learned from Dr. Kanjilal Sahab, and he also very much influenced by LM potency by Hari Mohan Chaudhary Sahab, he who is come from the Bangladesh and settled here and developed 50 millisiemens potency. Starting using homeopathic LM potency as well as preparation. I could not remember that any one other pharmacy is producing 50 millisiemens potency because before Chaudhary Sahab. Now still Chaudhary Sahab has got one pharmacy, international homeopathic pharmacy, and his son, Dr. Chaudhary, is running and working very hard to popularize this LM potency. Problem, you know that unnecessary people are going to produce understanding of 50 millisieverts potency. In fact, I know them. They have got no such reality as well as sincerity to develop the LM potency. This is one of the basic factors with the historical development I share with you and the audience with my pleasure, and you try this one.
Okay.
And I hope you will get wonderful results, sometimes very magical. His son is Shrikant Chaudhary.
Shrikant Chaudhary, yes. Yes, sir.
If anyone asks him, their pharmacy is going to produce the medicine of LM potency. I have some rare medicine which I bring from the USA. I have given to him also. And he prepared LM potency. So I think it's a good amount of LM potency. The consuming capacity, what Indian homeopathic physicians need, Shrikant is really producing and sharing all the professional peoples. But just I touch that people, the learning organ, they are not able to understand what is LM potency of 50 millisievert. All credits goes to Dr. P.R. Schmidt Saab and some of his friends who developed this LM potency. Before that, people are using, before the 6th edition publication, before the using, is a substitute of Hahnemann understanding. That is divided doses.
Yeah, yes, sir.
And later on, especially British homeopath, Margaret Tyler especially, she used, as they are very much higher potency users, so they use 200, 1M and 10M frequent. Sometime she used 200, 3 doses, followed by 1M 3 doses, 10M 3 doses, and wait. These are one of the very earliest expression of LM potency. Still, I am also using when I found the patient has got no strong, deep pathology. I need booster dynamic dose, 200, 1 nm, not LM potency.
Okay.
So I enjoy both the experience of our past installments. Yeah, mostly I said like that. The question of the selection of medicine is if you once never change, play with the potency. This is the best policy we have in our daily practice life. Upadhyay ji, I am very happy to meet you. No, especially on mostly our webinar or seminar like that, or is Instagram, but I have got extreme desire to meet you.
Definitely,
in your
sir.
clinic in Surat.
Sure, sir, definitely, sir.
Because some of the Surat people came to me, they called you, you are the god of the medicine.
Very nice, sir.
And that is a very, if patient is going to say that this is a god of medicine, 100% you don't say, or don't doubt. 100% is a pure verbal expressions of their experience. I think with my very simple understanding of LM potency, I share with you. You use and discuss your success or failure both.
So I'm using regularly.
Okay, sir. Thank you, sir.
But there are a lot of controversies are there in using LM potency. People are talking a lot of different view. They are talking about different
I
view
have
of.
very,
Okay, sir.
I am
No
very much
problem.
impressed. Your family also, your son,
Yeah.
your daughter-in-law, you and
Yeah.
your wife, all are the homeopathic, a type of, the holism of homeopathy in your home.
So thank you very much,
And
sir.
whenever you have got any opportunity to visit Calcutta, please meet me. I am
Sure,
waiting for that.
110%, sir. Sure, sure, sir. We are planning to call you soon, sir. We are planning.
And
Yes, sir.
anything apart from that, if you
Yeah.
have got any confusion,
Sure, sure.
I think you are a learned man. Sometimes I feel too, there is some confusion in my
Yeah.
understanding of homeopathic material, medical and practice.
Yeah.
I ask people.
Yes, sir. Sure.
So I give you importance of your courage. And I can say that you're bold enough to learn everywhere.
Yes, sir.
This
That's
is
the
my
only.
character. I found this only character with me, but you shared me. God bless with
Thank,
us.
thank you very
Any
much,
more
sir.
question? Okay, sir.
Yeah. Yeah.
थैंक यू सर
और कम तुम्हारा कोई क्वेश्चन
जी
और कोई क्वेश्चन
homeopathic approach in the case of tinnitus and stammering.
इनका क्वेश्चन है ये और जैसे ये उपाध्याय साहब को आपने सामने लाया है जो क्वेश्चन पूरा करें उनको सामने लाया कर तो उनको समझाने में ठीक से समझ में आएगा और ये बहुत टफ क्वेश्चन है इसमें लोग नॉन होम्योपैथिक ही टीचिंग कर देते हैं खैर हम ये बोलना चाहेंगे टिनिटस इज नो डाउट ए डिजीज ऑफ एयर एंड नर्व्स ऑफ द एयर but still we need the especially starting point, the anamnesis of the damaging of this nerve. And this nerve is maybe, according to the arthrogenic disease, as a arthrogenic disease due to the overuse of allopathic medicine. I just request them, this gentleman, to please read Margaret Tyler drug picture, salicylic acid, especially for the Meniere's disease and nerve defense, where she explained about the importance of salicylic acid. I'll give you two suggestions. It was the phosphorus personality who have got the nerve defense. But the beauty of phosphorus personality is that is a deafness specifically for human voice, not to all. Except human voice, phosphorus personality is going to be listen, hear, everything. Sometimes much up and down. But he is very much not able to understand or clarity with the human voice. Similarly, in the case of Ignatia amara, a medicine, especially Ignatia personality, having is a deafness for other voices except human voice. He listen, he understand human voice, but not able to understand the other voice except This is just opposite to phosphorus. One more medicine, and there are lots of medicine, but नाइट्रिक एसिड, जितना शोर जितना हंगामा होगा उतना ही वो आसानी से सुन सकेगा. These are the few indications which I like to share, and I request them. So please note the origin of the disease, origin of the deafness of the voice. कैसे शुरू हुआ था? And mostly there once upon a time the main preparations for the safety of human life is going to giving in the booster doses which may produce some of the hardness of the hearing. So these are one of the clue how it started. What are the factors? It should be also considered for the treatment of tinnitus. We consider first in tinnitus cases to take a help from some of the ENT specialists. It is due to the cervical or something purely to the nerve of. It is all concerns of the very important factor is a vertigo. Very severe vertigo, unbearable vertigo. So this is one of the way where I used to consider the tinnitus in my practice life. About stammering is a partly disease and partly habit. If you are not going to get in very magical result within a few days, you have to advise your patient to take long time treatment with some of the speech therapy. Those who give the suggestion how to speak and avoid making a copy of any stammer patient. In my history, I have got many cases of the stammering. It's purely due to some person, some uncle, some friends suffering from the stammering. He is going to copy and gradually is a part of his life. All should be considered for the treatment of stammering. और कोई क्वेश्चन है आपके?
नहीं, इतने ही क्वेश्चन था. और जैसे कि ये पर्टिकुलरली क्वेश्चन था टिनाइटस का और स्टैमरिंग का, ये स्पेसिफिक डिजीज के बारे जो लोग करते हैं, ये बीमारी में क्या मेडिसिन क्या, तो आप जैसे कि अभी बताया कि ओरिजिन कहाँ से डेवलप है, इसी के लिए आप रेफरेंस देते हैं अफोरिज्म 6 का, हैनेमन का, टेक नोट नथिंग एक्सेप्ट द चेंज ऑफ द बॉडी एंड द माइंड.
राइट.
हाँ, तो इसको थोड़ा एक्सप्लेन अगर कर देते.
You know, for every homeopathic prescribing, we consider symptoms, the changes from the health to the sick. When the sick develop the original symptom of the sickness, the basic symptom of the sickness, health from the disease, when patient was free from the disease, very healthy life, one simple attack which make the whole life of the patient from healthy to the sick. That is a moment of consideration for anamnesis in the word prescribing. I'll give you one example of prescribing in intrauterine life. For intrauterine life, when the patient is going to be pregnant, there are lots of changes before the pregnancy and just after taking pregnancy. Before pregnancy is the known personality of a woman have a desire for salt. Suppose I'll give you one example. But after the pregnancy, the mother is going to be double personality. And for this double personality, which is mother and the baby, is going to be a bond between the baby inside, mother outside. This bond is going to become one single, especially up to the 9 month, plus minus that 3 days. You know that there is a one tribe we call Swahili, African tribe Swahili. In Swahili language, there is a one compact word, Mama Toto. This means a mother associated with the son or child, Mama Toto. They believe that mother always contact with the child or baby always contact with the mother. In my practice, I use sometimes the mother constitutional remedy for baby, some of the very obstinate conditions, and I got very good result. So a bond, which I say means mother and baby is combined together, one. This oneness is very important. And like the whole personality of the mother during the time of the pregnancy suddenly change their desire and aversion. Previously, the mother was love for salt, now suddenly going to change the condition of the Mama Toto. The patient is going big and the mother is going to desire for the sweets or maybe sour. So this changes, hormonal changes, or we can say this Mama Toto, mother and child both together. This mother and child is going to operating together. The togetherness and the bondings are going to be changed. Some of the new expression, new phase, new symptomatology, new totality for prescribing during the time of pregnancy of a woman. I call intrauterine prescribing. So this oneness, baby and mother, oneness. So whenever a patient is going to become from health to sick, the sickness symptom is more important for consideration of the plea. I am considering both mental genetics and especially desire and aversion. क्लियर हुआ? क्लियर हुआ आपको?
हाँ,
और क्या क्वेश्चन है आपका?
बस और एक ये है क्वेश्चन पापा, एक क्वेश्चन है, जैसे एलेंस की नोट में सारे सिम्टम के साथ एक एक पॉइंट उठा के दे दिया गया है, जैसे कि एज अ रेफरेंस, जैसे हैनिमैन की बात कही गई है, लिपी की बात कही गई है, हेरिंग की बात, जैसे एकोनाइट में हैनिमैन का एक उठा के, तो वैसी एक सिम्टम है पर्सन सफरिंग फ्रॉम द अल्सरेशन ऑफ द लंग्स स्कारली विदाउट दिस एंटीसोरिक मेडिसिन लाइक कैलिकार.
ये सिम्टम, ये एक्सपीरियंस हैनिमैन का है, वो इतना जेन्युइन, इतना इम्पोर्टेंट और प्रैक्टिकल है कि एलन मजबूर हो के अपने केली का आपके चैप्टर में वन ऑफ द इंडिकेशन विथ रेफरेंस ऑफ हनीमैन उन्होंने दिया, और मुझको भी इस सिम्टम का तजुर्बा है, मैंने यूज किया इन माय लाइफ, वेरी अर्ली लाइफ में भी, और बीच में भी कुछ केसेस ऐसे आते हैं। यहाँ मैं सिर्फ अल्सरेशन की बात नहीं करता, एनी केसेस ऑफ द लंग डिजीजेस, when the people are taking allopathic medicine or homeopathic medicine, the result is not satisfactory. This not satisfactory result is demanding some of the homeopathic prescribing. A prescribing which I called in my life politics of prescribing. This politics we learn from the different angles of our stalwarts. Among them Hahnemann, Lippi. Lippi especially say about some prescribing in the full moon of Adam. Some different type of things I mostly collect and use in my small books of politics of prescribing. This is also one of the politics of prescribing. I use politics for the success, for the comfort, for the cure in homeopathic prescribing. So, Kelika, a medicine, especially for the lung cases, whenever I have got cases of the bronchitis, bronchiectasis, emphysema, and tuberculosis. Sometimes I found the cases of the tuberculosis was treated allopathically, but the patient is constant having a symptom of cough, early morning cough. थोड़ा cough हो गया, बस हो गया. A constant being. Considering Hahnemann advice, this politics of prescribing, to prescribe Kelicap. I used to give Kelicap with very much beneficial result, thanks to the Hahnemann and his observation in his Materia Medica. और कोई क्वेश्चन है?
नहीं.
So, in this, I hope we are going to start our webinars in Monday.
6th of June.
Huh?
6th of June. From Monday.
6th Monday. Or I hope that I consider the phosphorus personality for women eradication of the constitutional deficiency, whatever may be the name of the disease. This is the deficiency of the woman in the different level. Constitution, especially mathematics. If this deficiency is going to produce any disease, not only the female genital organs, the disease related to the female genital, the disease related to the breast, not only any complaint, a woman which is due to the deficiency of constitutional deficiency or mathematic deficiency, we consider prescribing for phosphorus. Or previously we give some other medicines, like especially I am saying, I discuss with my very much comfort the Sorinum, the Belispas, and last Bovista. Similarly, I have got future target of a medicine like phosphorus, which I got many good results in my daily practice life for both women, children, and old people. In old people, I once again going to repeat when I'm going to discuss about the old age or geriatrics, especially for phosphorus. I got very good result with the phosphorus in cases of the geriatrics problem, starting from the brain, the foot. I hope I try my level best that I do with my best effort to explain the beauty of phosphorus prescribing, especially on especially woman personality. So I just today I like to share one very important discussion with this one more indication of a medicine like petroleum. I have got wonderful case, Lajawab result of a stone in the kidney. In my remote OPD, of villages where I found the patient has got severe pain of the kidney region. And this pain was relieved by eating. जब कुछ खाता था दर्द कम हो जाता था. The more people are going to confuse with the hunger pain or the something wrong in the stomach. But the diagnosis, after the good amount of investigation, that no, this is purely due to the pain in the kidney. That is according to homeopathic philosophy and according to the pathology from allopathic side is a very rare, according to 153, rare. Hunger pain is important. For kidney pain, that is a very rarely we heard. And select this, and the patient has got at that time, being a Muslim, he has got severe aversion to the meat. And this severe aversion to the meat, I consider petroleum. Within a few months, I'm under 1 or 2 months like that. Because I mostly visited in this village area once in a month. And stone pass out. A miraculous result, a rare understanding of homeopathic philosophy, kidney pain relieved by eating, a Muslim aversion for meat is enough for me prescribing petroleum. I gave in petroleum in Adam 1 potency. And thanks God. Now I hope your this Instagram will become and more popular as well as beneficial to the profession. I hope we continue in our futures. Thank you. Thank you so much. Any question more?
नहीं.
Thank you.
And the people who are in the live now, and those who want to join the webinar on the female constitution part 5 can message me in the Instagram and in this profile. Okay, thank you.